what is evidence? This is one of the absolute wonderful components of evidence-based medicine and one of its biggest downsides. The wonderful thing about evidence is that it's an average. The biggest downside is it's an average. So the positive aspect of it being an average is that if you have 5 individuals in front of you, each of a different age, and you take the average, you divide it by 5, if nobody in the group is that age, then what you can say is the average age of individuals in that group is XYZ, but you can't say it actually applies to anybody within that group. However, it gives you a statistic probability of what is likely to happen. And this is why averages are important in healthcare, because if somebody comes in with non-specific chronic low back pain and the imaging comes out as clear and you have all this list, then you can sit there and say, probability-wise, your recovery and your prognosis will be this period of time. Now, it may not actually apply to that person. They may get better quicker, they may get better slower, they may not get better at all. They may spontaneously find improvement. But we do know that statistically, they're likely to find an improvement or a degeneration in whatever realm. And that evidence helps guide us as practitioners to say, we think it's most likely to be this. Another good example would be if somebody comes in and they have a headache and they're sweating, they have indigestion, they have shortness of breath, and they have painness and numbness down their left arm. There's a good chance that you're not going to sit there and say, oh, you have a trigger point, we should probably treat it. Probability-wise, you're going to look and say, you should probably see an ambulance or go to the hospital because this is an emergency. Now, it doesn't mean they're having a heart attack. There are a list of other symptoms that could replicate that. But probability-wise, risk-wise, we know that's the most likely outcome. So even if you're wrong, you're erring on the side of safety. And this is really where evidence-based medicine helps us. It helps us err on the side of, I'm doing no harm. But again, it's an average. And it's not representative of the individual in front of you. And that's the hardest thing for, I think, a lot of people who really like evidence-based medicine and really push it as a thought process. This is the hardest thing for people to come to grips with, is that it represents a statistical value that has nothing to do with the data point collected. And the person on the table, the person in the room with you, is the individual data point. And so they won't be the mean average, they'll be that data point. And that will shift the average, but this is where we start integrating the patient-centered care into it. So it gives us our probabilities.